The next two tests we'll look at are the Ober test and the modified Ober test, and that looks for tightness of the iliotibial band and or tightness of the tensa fasciae lata. With this test, we'll have the patient side lying, so let's have you lie on your left side. We're assessing the right hip and have you slide back just a little bit towards me. Thank you. A couple things you want to look for this test. You want to make sure the hip stays in neutral. A lot of times patients will substitute on purpose or sometimes non-volitionally they'll substitute. So I will make sure you first stabilize the hip. I will raise the leg up. This is the Ober test to start with. The knee is flexed, hip is extended, slightly past neutral. I'm stabilizing the superior iliac crest, extending the hip, and then I will lower, slowly lower the hip, and if it stays up, it's showing a positive test. And she does have slight tightness here. So I would say this is a positive test with the Ober test with this. Now, if I don't stabilize the hip and the leg drops down, it will give us a false negative test. So if the leg stays up and doesn't drop significantly almost to the level of the other leg, it's considered a positive test. If the leg does drop down, it's considered a negative test. Again, checking for tightness of the IT band and the tensa fasciae lata. That's the Ober test. The modified Ober test, same procedure. Again, keeping the person neutral. This case, I'm going to extend the knee, extend the hip, hold the superior iliac crest, and then again lower. Now, some substitution that typically will happen is the patient will internally rotate the hip and it will drop down and then give you a false negative test even though they may be tight, or they may tend to drop down more into hip flexion as opposed to keeping it. So you want to make sure you keep it in extension, neutral, not external rotation, but don't let it go into internal. And again, slowly let the leg drop down. And again, she has slight tightness. You can see she wants to internally rotate there, but she does have slight tightness here. So she has a positive test with that too. Some people are borderline and it may drop down and be slightly off the table, so they may have tightness. Of course, with the test IT band, I think still palpation is the best way to go. If someone tells you they feel tight, they have tenderness to palpation, and they have pain walking up and down hills or undulating terrain, moving back and forth, you can pretty much know they have IT band involvement. And that's the Ober test and modified Ober test.